module number 3. Hope you guys are enjoying my array of different scrub outfits for the course. I thought I'd mix it up a little. So we're going to talk about the different kinds of medical sales jobs, and I touched on this a little at the very beginning, but I really had no idea all of the different companies and areas of medicine that you can work in. From being an outsider, you're just familiar with some of the bigger name companies, the Johnson and Johnsons, the Stryker, companies like that. But you got to do a little more digging, and you'll see there's so many areas. And this is just kind of important to start thinking about that, like we talked about, visualizing, what this kind of money can do for you and your family and your life, but also visualize, what kind of area of medicine interests you. Is there someone in your family that maybe had some kind of problem and you've been curious about it? And I know a guy, he's always had eye problems, so he sells to eye surgeons, ophthalmology. Just a lot of different areas to think about. So we'll move into them here. Just kind of talk about, I went into what I do in spine a little bit in detail there, but where we come in, so every kind of drug, every medical device, in every town in the USA has somebody responsible for promoting that product or drug to the doctors. Because if you just ran ads on national TV, or if you just had advertisements in these medical journals, it's just not enough. And so often these products can be so similar that the doctor will choose based on what rep they like. If they don't see too much difference, they might just go with someone they like, someone they want to support. They know that selling this product pays our mortgage, and so they want to help support the people that they like and they've grown to know and trust. So touching here a little bit on pharmaceutical and medical sales. So I think the real main thing here is that medical sales usually tend to have a little bit lower base salary. For example, mine's $70,000. I think every Stryker job across the board is $50,000. And there's plenty of Stryker reps making well over $200,000. So keep that in mind. You're not going to probably get a big base salary, but you're going to make more in your commission. So, there's so many times people will be looking to jump into medical sales, but they're already making maybe $100,000, and then they're going to get a base salary of 50, and they're thinking, well, I don't know about this, but I assure you, with the stuff we talked about, why to get into medical sales and the potential, it's very high. And then in pharma, you tend to have a little higher base salary. A lot of people have 6-figure base salaries, and then you get bonuses and maybe some commission on top of that. But it's usually capped. For example, you might have a $90,000 base salary, and then you have a $40,000 bonus. So if you hit that, then you're at $140,000 a year. Which is great. So just something to be aware of while you're starting your search, that those are some of the differences. Some people also talk about how medical sales is a little bit more selling than pharma could be more educating. Either way, you're asking for that. You're asking a doctor to do something, whether it's use your medical device in the next case, or if it's starting to prescribe your drug over somebody else's on that next patient that comes in the door. So I don't tend to get too boggled down with it, because they both offer great lifestyles. So, you just kind of pick what you want. And, like I said, again, like with my wife, she doesn't want to have anything to do with being in the operating room and seeing, open wounds. And, sometimes you'll have some smells that might not be that great. And I remember the first time I got into the operating room, I even thought, I don't know if I'm up for this. This is pretty intense, but you just get used to it, just like anything else. Now I don't even notice. It's just part of life. So a couple things just to think about that while you're on this journey of what kind of what do you think might fit you better? So in medical sales, I think a lot of people think the very top of medical sales is the cardiac pacemaker reps. They're working with these renowned heart surgeons, and the heart surgeons, I mean, they do amazing work and they make a ton of money. And so, and these roles are really kind of patient centric. I mean, you're in charge of helping program these pacemakers. So you have a lot of patient interaction, which some people like and some people don't like. So some of those products are, like I said, pacemakers, and then more technical things, these cardiac loop recorders and defibrillators, things like that. So here's some of those companies just to be thinking about. You know, these are things that you can research on your own when you start to do your research when you want to, you know, break into these kind of jobs. So, you know, of course, it's best if you know somebody, but, you know, it's great to just do your research on your own. Check out the company's website, see if there is an opening in your area, and then start to network and use LinkedIn. Things we'll get more in depth on later. But these are kind of some of the main players in the cardiac space. So moving on to orthopedics. This is a big area. This is what I am in. And this also includes, you know, the sports medicine, handling shoulders, total joints, knees, hips, craniomaxillofacial. You know, people get in car accidents and they need small plates and small screws in their face. And so you'd be in charge of bringing those instruments and those implants into the operating room. You could even be a full-on orthopedic trauma rep. I know when I worked at Vanderbilt, I worked closely with those guys, and I mean, they work a lot. I mean, they are beyond critical in the operating room. I mean, they know everything, but they work long hours. It's trauma. So, you know, when that helicopter's flying into the hospital, it's usually them. Someone's gotten, you know, in a car wreck, broken bones. And usually these trauma reps are at level 1 surgery centers. So like the big hospital institutions that have teaching facilities where there's residents and fellows that, you know, it might be 2:00 in the morning and they're doing a surgery, and, you know, they're really relying on the rep because the rep has done this so many times, can basically teach a course on how to do this. And so it's just an integral role. It's really cool. But again, that's super long hours. It's really intense. And then in terms of orthopedic sales and what separates it from some of the other areas of medicine is you're going around with all these instruments and implants and moving them from hospital to hospital, and you're preparing for cases. So if I have a big surgery and then I have another one the next day and it's the exact same surgery, I might need to stay after the surgery and put together all those instruments and implants and get them ready for the next day. And that can take hours. I mean, that can take up a whole lot of time. So something to consider. Just, you know, always think about the pros and cons, and it's just cool that we can look into a little bit of this to help you with your decision. But this is where I'm at. I really enjoy it, even though it does require those extra hours of kind of maintaining your inventory and implants. But I'm kind of OCD, so I kind of like that. Here's some of the big name companies in orthopedics. DePuy Synthes, that's Johnson & Johnson, Zimmer, and Stryker, Medtronic, Orthofix. You know, all these companies. There's a whole bunch more once you start looking at it. I mean, like I said, with the pacemaker stuff, I mean, if you do a Google search and ask for all the companies, you'll find an array of them. Cath Lab Sales. So this is cool. Now, this area, you are going to be in the operating room, but you're not necessarily needing to be there every time. So my understanding of this world, and I have friends that do this, is once they teach a surgeon and their staff how to do the procedure and what separates their product, they're able to kind of get them up and running on their own, maybe do 10 cases where the rep's there. And then you're able to just kind of let them go and do it on their own and only be there if they need you there. And you can kind of focus on sales of new doctors to use your product. You're not handling all that inventory of these big heavy instruments and implants. You're coming in with a box of something sterile, and you might even have like a big suitcase you wheel in that has boxes of sterile implants into the hospital, and they might even keep most of them on the shelf. So you would just be in charge of, making sure your inventories are up for when you're having surgery scheduled. Because you don't have so much of the time consumed with patient interaction of pacemakers or with all the instruments and implants and inventory being moved around from hospital to hospital, you might have a bigger territory for these cath lab jobs. I think some of the guys I know that are in neurovascular, they have the whole state of Tennessee. So something else to keep in mind. You might do 1 or 2 nights in a hotel, and hey, that can be awesome for some people. So definitely something to consider, Cath Lab Sales. And here's some of the big companies in that realm. You might recognize Gore from Gore-Tex jackets. They make medical devices as well. They have awesome products. So DME, or durable medical equipment, this is kind of how I got my start when I broke into medical sales. I sold these stimulators that patients wear on top of their clothes that helps their bones heal. And I really liked that job. You basically sold to doctors in their clinic. You go meet with them, show them the product, show them how it's used. And then after the surgery, their nurse, their staff will call you and say, hey, Dr. So-and-so wants one of your stimulators. And they send you the patient information, and then I would contact the patient and I would take it to their house. So I have some really interesting stories about going to patients' houses. It's so funny. One guy, I think, sat me down and showed me his YouTube videos of him doing karate. It was really, really interesting. And so that was cool because, I kind of made my own schedule. I really just, I would knock out a bunch in 1 day, 2 days, work on sales calls, and I would leave most of my Fridays off. I did, we had great sales numbers and great doctors that would continue to prescribe for every spine fusion or every clavicle. The clavicle doesn't heal very well, so they'd want them on those. And it provided a great lifestyle, and it got me the experience in medical to then jump into the operating room. And after a few years of doing that, I still just had that itch. I really wanted to get into the operating room and see and be a resource in there. But awesome way to jump in. All these kind of supplies, all that stuff, durable medical equipment, and all just these medical supplies. I mean, there's so many things. The soap in the operating room, the gowns they have to wear, every little needle and every little disposable thing that there is has a sales rep, and that can be you. And these are awesome jobs that can pay really well and give you a great lifestyle. Here's some of those companies to look at. Don Joy and Bragg, those are our braces. If you had a back surgery, the doctor might want to put you in a brace. Same with ankles or anything like that. And these are some other medical disposables. I'd say Medline and Hillrom are some of the biggest names for just massive amounts of disposables for the hospital. So pharmaceuticals, aesthetics, injectables, biotech. This is where my wife is. I really wanted to touch on this because she just absolutely loves it. She has a super flexible schedule. She really just makes her own schedule. She doesn't have to worry about, there's a surgery this afternoon. I might need to just go ahead and get there early. Anything like that. I mean, she just comes and goes, and she's made so many good friends with these dermatologists and plastic surgeons that go to her yoga classes together, and just all this awesome stuff. Makes great money, up to $200,000 doing these jobs. And you have all these kind of cool pharmaceuticals, not just selling a pill, for heartburn to a primary care doctor, but all the way up to working with oncologists for these cancer fighting hardcore injectables. So this realm is just huge. And I didn't even put up every single one of these companies. I mean, you can do the searching because there's just hundreds and hundreds of them. So kind of think of an area that interests you, and you're going to be able to find these companies. So something to think about. I mean, just if the operating room is not right for you, that's cool, because there's tons of opportunity in all these other areas. Capital equipment. So this is selling really high end stuff. I mean, these are $1 million purchases. So you're really not just calling on the doctor, but you're calling on the hospital facility, really aligning themselves. I mean, right now, robotics is just the hottest topic. And so companies are going in and saying, hey, we'll put up a billboard to show all these people on the interstate to come to your facility because you are doing robotic, shoulder surgery or whatever it might be. And it's just a really cool area to be in. And so you have that. And then just looking at this picture, I mean, these tables are thousands of dollars. These lights, all this stuff. I mean, you can sell full operating room suites. That's including the walls. Every single thing you see in there has to be sold. And you'll find that some of these old hospitals, they need to be revamped. They need to get more customers. They need more patients in these hospitals. And patients are becoming smart customers. They want to go where it's nice and where it might be new and where they have new technology. So really cool area to get into. So here's some of those companies. Maquette makes a lot of the operating room full suites. So does Stryker. I mean, GE has all the C-arm x-ray machines and all that kind of stuff. Intuitive, now that's a great company. A lot of people find their start with Intuitive, breaking into medical sales. They have a role that doesn't just sell their robot, but you go into the hospital and you help that hospital get more and more users to use the robot. You might have an older guy who doesn't want to use the robot because there's kind of a learning curve. Your job is to get him on board, get him using the robot, in the lab setting where it's not actually with a patient in the room, get them comfortable with the technology and get them up and running. And they make great money doing that. Zimmer has a new ROSA robot, and Medtronic has the Mazor spine robot that is just completely taking off around the country. So, that's really it with this whole module, is to really think about what might interest you, what kind of lifestyle you want when you get into this, because there's so many areas. You don't have to just think, I mean, it is one thing to break in and just get your feet wet like I did selling durable medical equipment, but try to think long term. Yes, you might need a stepping stone job to get into medical. Then you might need a stepping stone job once you're into medical to get to the very top. They call a lot of these jobs we just went over destination jobs and destination companies. That's where you get somewhere. Like I've been with the company for 10 years, and that's because it's a destination job. You have access to all the best resources, the best name in the industry, and all the newest products, because your company has so much money to do research and development and continue to crank out awesome products for you, where these smaller companies, it's harder for them to do that. So start thinking about your destination job, because this is a journey. And like I said, this isn't piano in 21 days. This is a career that makes a ton of money for a long time. So just think of that ideal situation that you want to find yourself in.